Good afternoon, this is Dr. Do again. This video is Quarantine Special Edition video number 34. Today I am thinking to talk about the vaccine because especially at this time of the coronavirus outbreak, everybody talks about the vaccine. You probably heard vaccine a lot since you were born. Everybody since at the current time, since we were born, we all talk about the vaccines and immunizations. And particularly if you're young, you already know that before you go to school, before you start your school, you need to have the immunization form. Make sure you're immunized in all the schedules follow up. And if you're older, you probably have the immunization for the pneumonia, or every year for the influenza, particularly for those have other comorbidities, other diseases. So those immunizations, we hear it all the time. So I'm just going to explain or expand a little bit what are the vaccine, in terms of immunity, how is the vaccine working in our body, why some of the vaccines last for lifelong, some of the vaccine, for example influenza, you have to do it every year, or some of them every 10 years for the boosting. So let's start from the immunity. I think previous video I have mentioned many times about the body immunity. We have cellular and the humoral immunity, which is the third level of the defense mechanism. So that is the immunity, usually like cellular and humoral immunity. Humoral immunity means antibody related. So majorly we have B cells proliferate to plasma cells, produce antibody in the case that there is some bacteria or viral or foreign body or dead cells or cancer cells to cause this alert reaction. Okay, so the immunization, the vaccine, there in terms of the there's an active or passive immunity. What is active immunity? Active immunity is to body to expose the antigen and produce antibody by ourselves. So this is active immunity. For example, we give immunizations. Pretty majority of the immunizations are the active immunity. So we give either the alive, usually non-alive vaccine. For example, the polio. The first developed polio was alive. Usually for nowadays, we all use not alive the form because alive the form pose a high risk. So we give this non-alive polio. So we take it, and then this antigenic material circulating the body serve as the infection, so that our body produce antibody with the help of T cell, which is memory T cell. So body recognize this special antigen. If next time we get exposed to this bacteria, so the body remembered, oh, I know you, we have seen before, I have the weapon specific for you, which is antibody to against this second time invasion. So this is the mechanism. And the passive immunity refers to give the body antibody directly, usually after the expose. For example, I think last time I mentioned if you had injured, you do not know your tetanus status, and you have a deep wound from the rusty nail and very deep. Usually for this kind of situation, because it's a post-exposure, in addition to give the vaccine, the active immunity, give you the tetanus antigen shot toxin to stimulate our body generate the antibody. And on top of that, give you the immunoglobulin, which is antibody against the tetanus. So this body received antibody directly. This is called passive immunity. So the vaccine talk about the vaccine, majority of the case, usually it's the active immunity. So give the antigen or give a killed bacteria, killed virus, which contain the antigenic material. It serve as the like the bacteria or viral infected the body. So the body recognize and produce antibody, and with the help of T cell, the second time exposure will so the body will remember and produce the antibody to a defense or prevent the infection. So this is the mechanism of vaccine. In terms of the schedule, or how many times, like hepatitis B, for example, give 4 times lifelong, and there's first the initial dose, and then further on enhancement until the body fully immune to that antigen. So this is kind of evidence-based, so that's the already determined schedule for hepatitis B or all the other immunizations. For pneumonia, who are supposed to receive the vaccines? First of all, every children recommended, but some parents are against, oppose. That's the probably cultural or ethical reason. But CDC guideline recommended everybody should be immunized. So this is the guideline. And for those special group, some like older, 65 years older, pneumonia should have every 10 years. For the general healthy population, if you have other diseases, then the starting early, the starting age should be earlier, and also the frequency should be shorter. Instead of 10 years, probably 5 years. And for the if a flu immunization, since the flu is undergoing mutations very frequently, so the immunization is yearly, every year receive immunization, particularly to the health, work in the healthcare facility, or have some other diseases, chronic diseases like particular respiratory system disease, asthma, COPD, or cancer, or any other chronic conditions should receive. Actually, in general population, recommended, encouraged to receive. But for those patients with chronic disease, definitely you'll benefit from this yearly flu immunization. So that is in terms of coronavirus vaccine. I heard from the news it's under development, but I cannot make any comment on that. I just since we all talk about the vaccine immunization, so I just brought here to explain what the vaccine do and what the mechanism of the vaccine. So hope it helps. For those parents or ethical reason or any other reason to oppose the vaccine, I hope my video will give you a little more explanation why the vaccine is so important. Alright, so thank you for watching, and I will see you next time.